Thank you. This last presentation is brief, but it applies to judges, attorneys, and doctors alike. There are two references that I hope you might be interested in looking at. The first one is for judges mainly, from the Ninth Circuit Court. This is the last revision that I could find in 2015 about the wellness of judges. But I'm going to talk mainly about the wellness of all professionals. And you have already seen the mind diet during lunch. If some of you saw it, if you have not seen it, it is available for you on the website, and I recommend it. It is used primarily to help reduce the rate of progression of dementia or Alzheimer's and to perhaps prevent the development of Alzheimer's. The challenges of well-being are, from at least a medical standpoint, is we're seeing consolidation of medical practice. The doctors are being asked. Every time I say doctors, please remember I'm talking also about the judges and about lawyers. So it applies similarly to all professionals. But there are higher productivity expectations, reduced reimbursement, and there are so many laws descending upon us. And earlier today we heard about medical electronic health records. In medicine, they've come up with the Institute for Healthcare Improvement came up with what is called the triple aim. The triple aim of healthcare is to have better health for the general population at large, better care for individuals, and to provide the quality care at the lowest possible price. So, however, more recently, the quadruple aim was described, and what it is, it added, as you can see on the far right-hand side, improved physician satisfaction, improved judge satisfaction, improved lawyer satisfaction. The primary ethical issues that confront all professionals is a problem of alcohol and drug abuse. It was mentioned. Boundary violations were mentioned by Reggie Varghese. And another one is burnout, disruptive behavior. All these have been already mentioned, and the impaired physician. So if we look at boundary violations, for example, these include the list that you can see, and you can see also that it overlaps other areas. For example, here we see the misrepresentation of credentials, inadequate informed consent of the patient, the disruptive behavior, drug abuse or diversion, and so on. But we are also seeing inappropriate use of social media, financial irregularities, and of course the sexual misconduct. The burnout is common not only among physicians, but again among all professionals. But here we can really see the biggest problem is an occupational phenomenon. There is excessive work-related emotional exhaustion, and that is a marker for the quality that will be provided by the professional. The ramifications of burnout is the higher rate of error, disruptive behavior, decreased productivity, and lower quality of care, as well as decreased satisfaction of the client and increased alcohol abuse, broken relationships, depression, and suicide. And you've heard quite a bit of that earlier today. One thing that the definition of disruptive behavior disorder, it is a group of conditions that involve violating the rights and desires of other people and create significant conflict with authority figures and unhealthy functioning in society. The disruptive professional. Disruptive conduct, varies, and you may see threats, sometimes verbal threats. When it's more severe, you can see physical threats and throwing objects, and this disruptive behavior can sometimes be very intimidating. The impaired physician is a different condition. The impaired physician may be on alcohol abuse, which is the most common among physicians, by the way, and it is work-related stress. And Justice Gurich understands that very well, being in workers' compensation court, and this is a work-related problem, and usually function is adequate, usually. But there may be a new factor that was added, is the cognitive impairment or dysfunction due to age. And Dr. Piorkowski is kind enough to allow me to give a lecture on the 26th of this month. And if he will permit me, I'll be glad to send invitations to all the people that are here listening. Because we'll be talking in depth about the legal aspects of cognitive impairment, which I'm not going to talk about here today. The cognitive impairment, to give you an idea, the judges are older, doctors are older. Take an example, in the federal courts, there are about 1,700 judges, and their average age is over 65. Physicians, about 25% of the 900,000 physicians are over the age of 65. So there is a problem with recognizing if the professional is impaired. What is impairment? We talked about Alzheimer's, and I just want to run through these very quickly. The Alzheimer's, in 2021, this year, there are over 6 million patients with Alzheimer's. The total cost is about $355 billion, and one in three seniors dies with dementia. The Alzheimer's picture is shown here, as well as the first lady that was diagnosed, Augusta Deter, and that was back in 1906. There are 3 stages of Alzheimer's. There is the preclinical stage, where there are absolutely no symptoms. Then there is the mild cognitive impairment, and then there is the dementia at different levels. In 2018, the prevalence of it was found that the prevalence of Alzheimer's increases with age, and the survival time from the date that the diagnosis is made is about 6 years before they die. The U.S. population now is about 330 million. Here it shows the slide in 2017, but there are, of those at the age 45 and above, there are over 130 million people. And the reason I am mentioning that is that Dr. Brookmeyer at UCLA did a study that he reported in 2017 and showed that there were 46.7 million Americans, that's 35% of US adults over the age of 45, who have preclinical asymptomatic Alzheimer's disease. Fortunately, not everybody progresses to Alzheimer's in their lifespan. There is a genetic type of Alzheimer's, but it is in a small group of 2 to 3% of the population. People with Down syndrome, unfortunately, they develop Alzheimer's 20 to 30 years before other individuals of the same age, and that is very unfortunate. The Alzheimer's is more common in women. 2/3 of the women have the disorder compared to only 1/3 of the men, and this was found also at autopsy reports. The one thing that, this is a beautiful picture of a neuron, and I won't go through the details, but humans have an average of 86 billion neurons. And in case you want to find who is better than humans around, elephants are much better. They have 251 billion neurons. This is what elephant queen looked like before it was killed, and it had a beautiful tusks. There are several ways that the neuron dies. It can die from trauma, from stroke, from injury, from Parkinson's, Huntington's, and of course Alzheimer's. And what I'd just want to spend a moment tell you how the cells die. The neurons die. When they do die, they exude glutamate, and you can see the glutamate where the arrow is. And in Alzheimer's, two things accumulate. One is the amyloid, which is outside the cell, and inside the neuron is the tau tangles. When both of these are present, then there is the Alzheimer. This is what they look like, the beta amyloid plaques. They are proteins that accumulate outside the cell, and the tau is another protein, and it really looks beautiful if you want to think about it in terms of how the molecule is formed. However, that's what causes most of the trouble to the Alzheimer's people. Alzheimer's, again, it shows in these following two pictures how the cells are attacked. This shows the neuron healthy, and then the next slide shows the tau, the blue dots inside the cell, and then you can see the amyloid outside the cell. What happens to the cell? It becomes obviously destroyed, and there are some garbage trucks that come and pick up the dead cells. And what happens is that the brain, the healthy brain on the right side, compared to the severely destroyed Alzheimer's brain. Now, preclinical Alzheimer's has three stages. That's the asymptomatic Alzheimer's. It has three stages. The first stage is normal cognition, and here there is only accumulation of the amyloid. In the second stage, that's when tau begins to appear, but symptoms do not develop. And then subtle cognitive decline begins to form, and that's where the interest is to determine whether the professional, be it a judge or a doctor or a lawyer, at what point can you really find those people? Remember, it's 1 out of 10 people over the age of 65 have the problem. Now, you don't want to punish all other 90 people to find the 10%. So that's, I'll talk about and later on the 26th. But it is unfair, to me it's unfair, to have to punish the 90% in order to find the 10. You need to find a better way, and I hope we'll do, and I think this lecture will help in determining, finding those 10% without punishing the other 90%. Well, there is the annual wellness that is done by Medicare, and there is screening for cognitive issues. That's one way. The second way is screening the doctors and trying to find what their cognitive status is at a particular age. That's not been really as helpful, again, because of choosing a particular age. The tests that are used for doctors is the mini-cog. There are many tests, but those of you who would like to check out the SAGE at-home test, it's available free of charge. It's online, and I would recommend that you try to do that. Now, here is the way that we hopefully will solve this problem in the next few years. Blood test. There is a blood test available. It has not been approved yet by the FDA, and hopefully if it is approved, then that's one way to determine who has problems instead of having to find it, look at all the doctors or professionals. Presently, we have to use the cerebrospinal fluid to determine that, and sometimes it can be found in the fluid, in the urine. There are MRI, CT, and PET scans that are used, rather expensive tests. There are very specific tests that are used, which are PET scans, they're called. You can actually look for amyloid in the brain and look for tau in the brain, and these are available and expensive, and hopefully we might have the blood tests soon to determine who has the amyloid and even which part of the body. You can have amyloid in, as you can see in the, like a rash on the hand. You can have it in the heart, and here you see it under microscope after staining it, and it can cause hemorrhages in the brain.